have been in this innovation space now for a generation, uh, maybe longer. And I think you follow this as closely as anybody in the country, and you parse through fact from fiction, what is real versus what is marketing. And I have both developed an acute optimism and an acute cynicism that go hand in hand when I think about innovation. How do you parse out what is marketing when we're talking about technology and innovation and what is real, what is meaningful? What do you kind of look for to try to discern what is going to move the market and disrupt healthcare and what is maybe more talk than action?
I think you have to start with measurable results, right? And I think to put some context around that, if you take a look at, what's the so what of connected health and actionable data? Take a look at companies like Verta Health. The numbers that they're posting are just absolutely astounding. I started writing my books after connecting with a couple of schoolmates that I played ball with back in Vermont. Now, these were next level kind of athletes that played for the University of Pennsylvania. And they both confided in me that they now have type 2 diabetes. And me coming from the tech sector before I got into healthcare, I asked them, what kind of tools are you using to better connect with your doctor, your clinician, and others who can help keep you healthy and happy? And, one just laughed and said, "Hey, this is type 2 diabetes. We did this to ourselves. No one cares about guys like us." And the other guy was a little bit more somber. He was looking down and he said, I'm going to have my foot amputated in about 6 months. And when my foot hurts so bad that I can't stand it anymore, I schedule an appointment with my doctor. And I thought of Verta and how they've now reversed type 2 diabetes for 60,000 members or customers. Think about the enormous savings in just in insulin alone and in meds. And I thought, what good is all this innovation if we're not getting the message outside of healthcare to a broader audience who really could use this information in a way that's beneficial for them? So I think that's a good example of where they have basically collected data, whether it's from your monitoring your glucose, stepping in and intervening with people who are clearly trending in the wrong direction, and then connecting them with a stakeholder who can help them do something about it. And what they learned was kind of eye-popping. It's not always a clinician. Sometimes it's a nutritionist. And sometimes it's a mental health resource or just simple coaching. I mean, there's cyclical things I think that people go through, the death of a loved one, the passing of a spouse or someone in the immediate family that sort of sends us into an annual downward spiral. And I think one of the things that Verta Health was really good at pioneering was recognizing the triggers, recognizing the events, and being there as a resource for people when they need it, not overwhelming them when they don't, but being there for them when they need it. I think the other thing that they recognized was while they're a good dashboard and they're good at collecting and analyzing the data, those who take action on the data are what you need to connect to. And sometimes that's your clinician, sometimes that's your doctor, sometimes that's a fitness instructor, sometimes that's a nutritionist, and sometimes that's just a coach who can help remind you of the healthy habits that you need to reinforce to be the best version of yourself you can be.